Before you start with any type of procedure, make sure to do the hand washing with soap and water and hand gloving with sterile or clean gloves. These are the two examples of aseptic procedures used in medical settings. The purpose of hand washing is to free your hands from contamination, and washing your hands properly with soap and water can help prevent the spread of microorganisms. Do not let your uniform touch the sink. The sink is contaminated. Uniforms may carry organisms from one place to another. Turn on the faucet to a gentle stream and leave the water running throughout the procedure. Wet your hands to 2/3 of your elbow. Put a considerable amount of soap on your palm. Rub your hands vigorously, keeping fingers pointing downward. Wash your hands, forearms, and wrist for 30 seconds. Palm to palm, finger interlace, back of the hands, knuckles to palm, fingernails. You may use the orange stick. Organism can lodge and remain under the nails where they can grow and spread to others. If cleaning instrument is used carelessly, organism may lodge in injured areas and will cause infection. Dispose the orange stick into a proper disposal area. Rinse your hands and wrist to your elbow in a downward position. Make sure that the soap are gone. Dry your hands well with a paper towel to avoid moisture, because moisture is crucial for bacterial growth, so you must dry your hands properly, and then use the paper towel to turn off the faucet to avoid recontamination.
Of infection by protecting both the patient and healthcare worker from the harmful microorganisms. Collect
Grade the patient, introduce yourself, and verify that you are with the right patient, and explain the procedure. All necessary equipment and supplies for a smooth carrying out of the procedure. For the equipment, clean gown or clothes, towels and wash clothes, soap or body wash, shampoo, conditioner, and non-skid footwear or non-skid bath mat on the bathroom floor and in the shower, bath chair or shower stool, or you can even use commode. Proceed to the patient's room. Knock 3 times for courtesy. Before showering the patient, make sure to turn off all the cooling appliances to prevent the patient from chilling, and open the windows and doors slightly to promote circulation. The vital signs of the patient following proper infection control practices. Assess for any rashes, sores, reddened areas, discharge, or any unusual actions of the patient. Assess the patient's readiness and ability to stand and move safely, and assist the patient in the bathroom. Turn on the shower and make sure the water is in at least 40.5 degrees Celsius in temperature. Assist the patient into the shower and onto the chair if needed. Give the patient as much privacy as is safely permitted. Put an occupied sign on the bathroom door and check the patient every 5 to 15 minutes. When the patient is finished washing, turn off the water and assist the patient out of the shower.
Brushing maintains oral hygiene by cleaning teeth and gums, preventing plaque build-up, cavities, and gum disease. Offering urinal and bedpan. Collecting urine and stool specimen. Purpose of collecting stool specimen: to detect infection, parasites, or blood, to diagnose gastrointestinal disorders, to assess digestion and absorption. Bedpan, used to collect urine and feces for patients who are unable to use the toilet or commode. Assist in meeting elimination needs while the patient remains in bed. Commonly used for bedridden patients, those with fractures, paralysis, or severe illness. Help prevent accident and maintain cleanliness and skin integrity. Urinals, used to collect urine for patients who cannot walk to the toilet. Help maintain comfort, dignity, and hygiene. On tray. Proceed to the patient's room. Knock 3 times. Place the medication on tray. Proceed to the patient's room. Knock 3 times for courtesy and make sure the room is well lit. Identify the patient using 2 identifiers. Check for allergies. Explain medication to the patient. Before administration, wash hands to prevent the spread of microorganisms. Verify physician's order. Prepare correct dose. Place after administration. Dispose of used supplies properly. Wash hands. Document medication, dose, time, and route. Observe and record patient response. Report any adverse reactions or refusal.
assisting elderly in changing gowns. Before you start with the procedure, make sure to prepare all necessary materials and supplies for smooth carrying out of the procedure. Perform proper infection control practices by hand washing and hand gloving to prevent the spread of microorganisms. Bring a clean hospital gown to bedside. Raise the patient's shoulder from bed as much as needed. To locate the ties or snaps at the back of the patient's neck and unfasten the gown. Take gown sleeves off the arms, but leave it across his chest for the time being to prevent unnecessary exposure to his body. Place clean gown over and slightly lower than the used one. And if the patient has disabled or bad arm, place the sleeve on that arm first. Put the sleeves by placing your hand through the clean gown sleeve and gather it up. Then, still holding it so, gently grasp the patient's arm or wrist and use the other hand to pull the sleeve into position to prevent the patient from trying to find the hole. Repeat the step with the other sleeve. Holding the clean gown by collar at the patient's chin, slip the other hand underneath the clean gown and pull the used gown off the patient. Assisting elderly. Look for personal items that may be pinned on the gown that may be valuable to the patient before folding and placing it into the laundry hamper. Adjust the clean gown at the shoulders and back, then fasten snaps or strings at the back and neck. When tying the gown with strings, do the one knot and shoe tie. And then do the aftercare. Remove gloves and do the hand washing. Record and report.